Hello class, my name is Dr. Kennedy Paron, and today we'll be discussing Chapter 4, Section 5, Characteristics of Neonates. So how do healthcare professionals assess health of neonates? That would be a good question. So they use what's called an APGAR scale, which is utilized to measure the health of the neonate. The APGAR scale measures 5 different areas on the newborn health assessment, which is appearance, pulse, grimace, activity level, and respiratory. So APGAR is based on the 5 measures of health, and the neonate can score a 0, 1, or 2, 0 being the worst and 2 being the best in each section. So more about the APGAR scale, the 5 areas of measurement. First, in appearance. So we're going to check the skin color. Maybe it's a little pinkish or bluish or pale, dependent on the appearance of the skin, whether it's healthy or unhealthy. This would lead to the scoring. Next, the pulse would be assessed and the heart rate would be taken. Third, the grimace or the reflex irritability. Fourth, activity level and the muscle tone. And fifth would be the respiratory effect or the breathing abilities. So now we're going to talk about NBAS and NNNS. So first, for NBAS, the Brazelton neonatal behavioral assessment scale is utilized. This is to measure behaviors and reflexes of the baby. This scale was created by T. Barry Brazelton. The NNNS is similar to the NBAS, as it was also made by Brazelton. However, this one is the Neonatal Intensive Care Unit network of neurobehavior scale. So it's assessing intensive care unit babies who are sicker. So this scale was created by Brazelton and colleagues in order to speak to parents about potential risks, especially for infants exposed to substances in utero. So our next section of this chapter is what are the reflexes and what are they shown by newborns. So shortly after birth, the infant could actually swim. It has the innate ability and the reflexes to do so if thrown in the water. Reflexes are unlearned, stereotypical responses to a certain stimulus. And these actions do not require higher brain functioning. Example would be scratching an itch or raising your hand, for example. So in testing neonate reflexes, this is to test the neural functioning of the nervous system and allows babies to be aware of their reflexes and abilities. So if they're slower than normal, absent, or even weak, doctors could say that most likely that would mean that they're slowed, they have slow responsiveness, they're premature, they have a brain injury, or possibly an intellectual disability as well. So next we're going to talk about the rooting reflex. This is a reflex that infants have where they turn their mouth and head in the direction of something stroking its cheek or the corner of its mouth. This rooting reflex is a reflex that is a shallow reflex and is important for the survival as it helps with nursing and feeding. So next we're going to talk about the Moro reflex. This is a reflex in which the infant arches their backs and flings their arms and legs and then draw them back into their chest in response to positional change. That is a sudden change for them. So if the baby does not have this reflex naturally, they are still maybe immature or may have brain damage, unfortunately. Next, we're going to talk about the grasping reflex. So this is a reflex that infants grasp objects that cause any pressure against their hand, no matter how small. So during the first few weeks of the life of the baby, they will grasp onto items more and more. This is voluntary grasping that can occur within 5 to 6 months out of the womb for the baby. An example would be grabbing their mother's hair. So we have a few more reflex types to cover. We have the stepping reflex. This is a reflex in which infants take steps when they're under the arms held under the arms and are led forward and have their feet pressing against the ground. So if they're supported by an adult, they will do steps towards walking. Babinski's reflex is the reflex in which infants' toes curl underside when their feet are stroked, almost like a tickling motion that they can't control. And finally, we have the tonic neck reflex. So a reflex in which an infant turns their head from one side and extends an arm and leg to the other side and flex their limbs in the opposite direction. So this is also called the fencing position because it looks like similar to when people do fence for sport, how they are posing. So how well do neonates actually see the world around them and sense the world around them? They use the 5 senses to do so. So first we have vision, hearing, smell, taste, and then touch. So for vision, there's visual acuity, which is the sharpness of the infant's vision. And then the ideal would be 20/20 vision, which is perfect vision. Babies actually see the best through the centers of their eyes because they, unlike adults and children, they do not have peripheral vision yet. So visual accommodation is the automatic adjustment made by the lenses in the eyes of the baby to bring objects closer into focus. And then lastly, we're going to talk about convergence. So this is the inward movement of the eyes as they focus on an item that is drawing near. Think about how when we were kids, sometimes friends would take a finger and put it up to our nose, trying to get us to go cross-eyed. Next is hearing. So babies react to different amplitudes and pitches. They hear differently. So first we'll define amplitude. Amplitude is the maximum vibration of a sound wave. The higher the amplitude or the sound waves, the louder they tend to be. So the pitch is a little different. It's the highness or lowness of the sound. This is determined by the frequency and number of waves. For touch, infants are very sensitive to touch. This helps them reach out and enjoy soft, enjoyable items. This also helps them when exploring the world and bonding with their parents, and even staying away from things that they do not like the touch of, maybe something prickly or hot or sharp. So many reflexes are actually activated by the pressure put on the infant's skin. Next, we're going to talk about taste. So infants do actually taste. They start tasting in utero. So they show taste preferences with their facial expressions. Many infants smiled and showed an expression of joy to sweet things, but for bitter and sour foods, a frown was delivered by the infants. For neutral tastes such as water or tasteless, there was no facial expression given. And finally, smell. So babies can smell very early in life. They can smell very strong odors more than less potent smells. They have similar odor preferences to children and adults. So some examples would be skunk smelling really bad, but a cupcake being preferred because it smells really good. So next we're going to talk about early education for neonates or babies. So they do not learn as quickly or as well as older children, but they do learn through 2 types of conditioning, classical and operant. So first, let's define classical conditioning for neonates. So this is a baby's involuntary response to a stimulus. So an example would be babies blinking when they hear a certain conditioned sound. Operant conditioning for babies would be the reflexes being modified to go along with the reinforcement. An example of this would be babies sucking in a pacifier in just the right way to start a recording of their mothers, reading a story that was being played from The Cat in the Hat that was read to them in utero. And this is an example from your book. So what patterns of sleep and wake are found with babies? First, adults tend to sleep only 1/3 of their time, whereas babies sleep 2/3 of their time. Babies even sleep an average of 16 hours a day. So then we're going to discuss REM and non-REM sleep. So REM stands for rapid eye movement sleep. This is periods of sleep during which we are likely to dream, as indicated by our rapid eye movement back and forth. Non-rapid eye movement sleep depicts periods of sleep in which we are unlikely to dream because there is the lack of our eyes moving back and forth. Something called an EEG measures brain activity in sleep. And this is an instrument that measures electrical activity in the brain. And it's usually used to measure it as we sleep in sleep research. So why do babies cry and what can be done to soothe them? This is a very good question. So the main reason that babies cry is actually due to pain. Close physical contact with the mother seems to be the most soothing thing for a baby when they are crying. Contrary to popular belief, actually, offering comfort to a crying baby does not spoil them, it actually helps them. And certain high-pitched cries actually are due to the child being ill. Next, we will talk about soothing. So soothing can happen when you're sucking on a pacifier as a baby because it calms them down. And skin-to-skin contact with a parent is very soothing for the baby as well. And being held, maybe wrapped in a blanket and warm, maybe given a bottle, maybe a familiar toy. In the next section, we will discuss 4.6, sudden unexpected infant death and sudden infant death syndrome.